Thank you for joining me today on learning how to significantly improve patient outcomes through safe and effective weight loss and increasing revenue for you and your practice. My name is Dr. Dominic Taranelli, and I'm an Optavia weight loss and business coach. I work for leading physical rehabilitation hospitals and clinics, as well as recognized universities. I've been helping others lose weight and transform their health for years. And in this presentation, I will cover how Optavia has been transforming the health of over 1 million people and the finances of thousands of health professionals just like you. Imagine if there was an easy-to-follow protocol to help your overweight and obese patients overcome their weight barrier and create a vibrant life free of obesity-related diseases by helping you increase revenue. Wouldn't that make your profession more rewarding? Of course. And that is what Optavia has done for many other health professionals. And by the end of this webinar, I will show you how our program can earn you significant monthly income while improving the health of your patients. Optavia, creating health for your patients and your practice. Optavia offers a program to help your overweight and obese patients predictably reach a healthy weight by learning healthy habits and lifestyle changes to create health for a lifetime, as well as provide you and your practice with an additional revenue source that stands outside of managed care. Who is this presentation for? Well, it's for both medical and allied health professionals. If you're a health provider serving people that need to lose weight, then this is for you. Before we go into detail on our transformational program, I'd like to give you a little background on who we are. Optavia is a company committed to providing solutions for creating optimal health. We have over 22,000 coaches and healthcare professionals. And at the top of the screen is our co-founder, Dr. Wayne Anderson, who's a New York Times best-selling author and a critical care physician. Dr. A spent years working long days in the ICU, fighting to keep people alive. But the long hours and lack of creating optimal health in the people he was treating left him wanting to do more. So in 2001, Dr. A left his position as one of the world's leading critical care physicians to help create a company dedicated to preventing disease rather than reacting to it. And our mission is to get America healthy. And helping this mission is our parent company, Medifast, which is a leader in safe and effective meal replacements for over 30 years. Their products and program have been recommended by over 20,000 health professionals since 1980. And our 5-in-1 plan is proven safe and effective in clinical studies conducted by researchers from major universities and teaching hospitals. And Medifast is also an American company that owns its own research and development manufacturing and warehousing facility, and is a New York Stock Exchange company, and Forbes had Medifast as America's most trustworthy company 2 years in a row. And what we offer patients, well, our model is very unique. And Optavia is not a diet, it's a comprehensive optimal health system with 4 components. So patients reach a healthy weight with the support of a coach and community while learning habits to create health for a lifetime. And then our results are just extraordinary. Now here's showing Dr. Joe, a leading surgeon. He has been overweight since childhood, always had a weight problem. And on our program, he lost over 220 pounds within a 9-month period and has maintained a healthy weight for over 10 years now. And then we also have Ron and Shirley. Ron lost over 70 pounds and has maintained it for years, and Shirley lost over 217 pounds and has also maintained it for many years now. And then prior to Optavia, Don was trying to lose weight and get in shape by exercising about 5 days a week. However, after 5 months, he actually gained weight by putting on muscle and really not losing much fat. Exercise is a great strategy for maintaining weight and staying healthy, but unfortunately after age 40, it's a difficult strategy to lose weight. And on our program, Dom lost 70 pounds in less than 4 months, and Rita lost 26 pounds during the same time period as well. And they've maintained their weight now for over 10 years. And our solution has made a difference in the lives of thousands of people with predictable weight loss transformations. And now with adult obesity reaching over 37% and over 70% are either overweight or obese, the need for a comprehensive, clinically proven weight loss program is greater than ever before. And then in 2011, according to the Centers for Disease Control, there were many states that were under 25% obesity rate, and then there was no state greater than 35%. But in the recent years have been really a progressive increase in adult obesity. These numbers are really just getting very high. As we'll discuss here, in 2012 and 2013, we have an increase. And in 2014, continues to increase, as well as 2015 and in 2016 as well. And then now in 2017, as you can see, really the obesity epidemic has been increasingly getting worse. And then now in 2017, there were now 7 states with a greater than 35% obesity rate, and many more with a greater than 30% obesity rate. So really now is the time to help reverse the trend of obesity and many other related health disparities that go with it. And the progressive dangers of obesity. Overweight and obesity over time can lead to a cascading effect on one's health, leading to insulin-resistant, metabolic syndrome, type 2 diabetes, cardiovascular disease, and certain types of cancers. This progression from bad to worse is based on the typical American lifestyle. And really today, modern medicine treats many of the symptoms by prescribing drugs to maintain diseases like diabetes and high blood pressure, high cholesterol, and so on. But all drugs have certain side effects, and these examples are really not getting to the root cause. And our approach is to get people to a healthy weight and to have them learn healthy habits to help alleviate these conditions. And the healing effects of weight loss really occur when having a patient reach their goal weight. And it's been documented to resolve many obesity-related conditions, especially metabolic syndrome, cardiovascular disease risk factors, type 2 diabetes, joint pain, and many other health disparities. And in addition, there are several key elements of being physically healthy. It includes having a healthy weight, healthy eating, healthy motion, healthy sleep, healthy stress reduction. And all these areas are important, and we offer support for each while patients are reaching a healthy weight. And the 4 components of our system, there's the Optavia Health Coach, the Habits of Health System, the community, and the fuelings. And what makes this program so unique is really the first component of our comprehensive system is a personal Optavia Health Coach. We'll support your patients on their health journey. And then when we speak to many patients or clients who have been successful, many state that having someone side by side walking this journey with them has made all the difference. And the fuelings and the programs work when you follow the protocols, and having a coach is vital in providing personal support, guidance, and encouragement. And then really, all coaches are very caring, knowledgeable, they give one-on-one support, and they're encouraging healthy lifestyle adaptations by guiding patients towards healthy habits. And another significant approach to our comprehensive system, and really what sets us apart, is the Habits of Health system. So what is so different about Optavia? Well, it's our ongoing process. We pick up where really most diets leave off. We're going to step you through the process, preparing for your journey, and then reaching your healthy weight, which is just really the starting point. And then we'll help the patients transition to a healthy eating program with the Habits of Health system. And they will learn then the habits and behaviors to create and sustain health for the long term. And Dr. Ray's Habits of Health system contains everything your patients need to replace any poor eating and other lifestyle habits that may have developed over the years with healthier ones that will contribute to their long-term success by making small, consistent changes in their habits. They can learn to maintain their results for life. And we provide support in an optimal well-being community. And these tools include local and virtual community events, support calls and interactive webinars, Habits of Health video calls, Optavia Premier membership benefits, nutrition support, our team approach to coaching, which includes Facebook support groups, Pinterest recipe pages, Optavia YouTube channel, and podcasts on iTunes. And each of these things, but we're really so much more. It's really a place where you can come and be supported for peer and personal support. It's a community of other like-minded people who are focused on creating health in their lives and sharing it with others. Our community is the attraction that binds really both patients and their coaches to one another. It's a place for friendship and mentorship and a place to learn and grow. Optavia Fuelings and our programs have been clinically proven, safe, and effective. And then reaching a healthy weight with the 501 plan, the 5, which consists of 5 Optavia Fuelings, and we have over 70 different fuelings to choose from, including shakes, soups, smoothies, oatmeals, fruit drinks, iced teas, hot beverages, bars, puddings, cereals, and so much more. All fuelings have roughly about the same nutritional footprint: 11 to 14 grams of protein, 11 to 14 grams of carbohydrates, under 2 grams of fat, and about 110 calories each. And eating 5 fuelings a day every 2 to 3 hours will increase metabolism, satisfy hunger. The fuelings provide 100% of over 25 vitamins and minerals, as well as probiotics, which are fantastic for digestive health. And all of our fuelings are very nutritious, low calorie, satisfy hunger, high quality protein, low glycemic, very portable and convenient, very easy to prepare, and cost neutral. It's really about what most people are already spending on food. And the one consists of 1 lean and green meal prepared by the patient. And the lean and green meal consists of 5 to 7 ounces of lean protein plus 3 servings of vegetables and up to 2 servings of healthy fats. It really depends on the lean protein choice. And for convenience, we also offer prepared lean and green meals, which can be prepared in about 90 seconds and meet the requirements of the lean and green. And then how it works. Well, before the program, the reason people gain weight is a result of more calories in than calories out, and excess energy is stored as fat. And phase 1, we introduce the 501 plan, which is about 900 to 1,000 calories, and this creates a calorie deficit between what the body needs and what is being consumed. And then after 3 days, the body goes into a fat burning state, which starts using fats that is stored as an energy source, allowing for steady weight loss. In addition, people have more energy and are less hungry at this point. Then after about 3 weeks on the program, a moderate exercise routine like walking is introduced, and if the patient is already exercising, reducing the duration of the exercise routine is advised. And then after reaching a goal weight, a transition process begins by adding more calories and increasing whole food consumption. And then at phase 2, it's learning the habits to sustain a healthy life, moving towards optimal health. We offer an optimal health 3 and 3 plan, and it's help sustain a healthy weight using 3 balanced meals and 3 Optavia fuelings each day. Additional foods can be added in the right portion sizes for variety and flexibility. And now I'm going to talk about implementing this service into your practice and enhancing your revenue. The benefits to you include gaining a value-added service and a scientifically based weight loss program, provide a proven solution for your patients desperately looking to lose weight, help improve patient outcomes, the quality care metrics, increase the referrals, accommodate patients looking for non-drug solutions, and gain an income source not controlled by managed care. Create a competitive advantage by building patient loyalty, promotes healthcare versus sick care, develops advocates for your practice as well. Optavia can help you create significant add-on income potential of 5 figures monthly. There's no inventory, there's no minimums, there's no quotas, very low startup at $199, and repeat income potential. What is our business model and what makes it unique? Well, really, when this model was created, nothing really like it existed before. There's really no one quite like us. And we're unique because no one else does exactly what we do. We're extraordinary because of the results this model has produced. And we're really transformational because we've been able to provide a business system that creates predictable transformations. And then who does the coaching? Well, there are three different options. You refer the patients and we coach them. We partner with you to coach your patients and share the income, or we train someone in the practice to do the coaching. And becoming an Optavia coach is really a business opportunity with no guaranteed income. It's really like owning a micro weight loss franchise. As a coach, you have two different options to build on your business. You can be strictly patient-focused and only work with patients you personally enroll, or you can be both patient-focused and health coach-focused. The second strategy is optional. And the circle is bigger to signify really that there's great opportunity with strategy 2. And our business and competencies are progressive. The more people you help, and the more that you can earn. Now let's focus on income number 1. Health coach income for supporting patients. Here's what you'll get as an Optavia coach working with your patients. About 15 to 31% compensation for coaching patients, with new coach bonuses and consistency bonuses. The coaching is simple, fun, and doesn't take much time. And the economic driver is the use of the Optavia feelings by the patients. And patient support compensation is based on a higher percentage. And as a coach increases monthly order volume and gets certified as well, you can see up to 31%. And what helping patients could look like. As a certified Optavia health coach, you could potentially earn approximately $345 a month if you have 5 active patients who are ordering $300 of fuelings. And if you really start increasing that number, you could potentially begin earning even more. About 15 active patients on the program would equal about $1,200 a month. And if you have 25 active patients, you could potentially earn more than $2,000 a month. And about 40 active patients over $3,000 a month, 60 active patients over $5,000 a month, 80 active patients over $7,000, 100 active patients over $9,000, and 120 active patients would be over $11,000 a month. So there is definitely opportunity for significant monthly income for sure. Let's look at the outcomes of proper coaching. At the end of the day, we really have a healthy, thriving patient who has learned the habits of health and is very happy. A satisfied patient will either refer others back to you or even possibly join Optavia as a coach and pay it forward. It's really organic growth. And the fact that the 22,000 plus Optavia health coaches, about 80% were first clients that got healthy and then decided to become coaches as well. And then the other 20% are health professionals looking to help their patients lose weight and get healthy. The business coach compensation is based on really mentoring individual health coaches and helping them succeed, building successful teams of coaches. Business coaches earn between 2 to up to 12% on group revenues generated by coaches on their team. If you want to participate in the business coaching opportunity, we could also schedule a future call about that as well. Additional resources on the compensation plan can be found on the Optavia website. Health professionals just like you are really making a huge impact and really getting paid what they're worth. Getting started is very easy. It's very low startup cost, only $199. You get a personalized website with a back office to track your patient orders, and full business coaching to get you up and running, and really expert support as well. I want to thank you for taking the time to learn about the transformational opportunity Optavia has to offer for your patients and your practice as a health professional. If you think Optavia may be the right fit for you and your patients, then please schedule a personal one-on-one call with me to further discuss joining Optavia's community of other like-minded professionals dedicated to the mission of getting America healthy through safe and effective weight loss. I look forward to helping you and helping you get started. Thank you so much.